Pregnancy and childbirth can be one of the most exciting as well as anxiety-provoking time in a woman's life. Especially with social media, it's so easy to be inundated with pictures of the most perfect gender reveal party, baby showers, the perfect birthing experience. But realize that it's a very self-selected and curated viewpoint. There are many women who may have a completely different story to tell. Stories of difficult pregnancy, traumatic childbirth, and consequences from that childbirth that they're dealing with many years after their delivery. But we don't talk about it. And worse, women go into this not knowing that these are possibilities. One of the most frustrating things for me as a urogynecologist is that why is it that women find out about me or my specialty only after they're suffering with some of the consequences of pelvic floor dysfunction, whether it be from childbirth or something else? Why aren't we talking to young women about their pelvic floor way before they consider pregnancy? So today we're going to be discussing about all things you wish you knew about your pelvic floor before you got pregnant. Hi everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and welcome back to the channel. So I made a list of questions that I often get asked by my patients or even friends and family or colleagues who may be pregnant or recently had a baby or considering pregnancy. And I think it's actually really helpful to discuss some of these questions with you all. My hope is that after today, you'll have a basic understanding of what the pelvic floor is, what pelvic floor dysfunction means, and also what are some changes that happens to the pelvic floor during pregnancy, during childbirth, as well as after. The first question that I often get asked is, what is the pelvic floor and what is pelvic floor dysfunction? So the pelvic floor is a group of muscles and connective tissue, which essentially forms the base of our torso. And what it does is it helps support our pelvic floor organs, which could be things like the uterus, the bladder, the rectum, the intestines. So pelvic floor dysfunction in simple terms means when the pelvic floor muscles as well as the organs it's supporting are not working the right way. And why is that? There is a whole host of reasons. But as it relates to pregnancy, women can develop things like frequent urination, urinary leakage, not being able to control their urine or control stool or gas. They can have pain with intercourse. They can have just pelvic pain in general. So these are some common pelvic floor dysfunction that we hear about from women who are either pregnant, recently postpartum, or had a baby within the last few years. The next question is, how common are these pelvic floor dysfunction during pregnancy or after? The answer is most women will notice some variation of the various different kinds of pelvic floor dysfunction at some point in their pregnancy, especially in the third trimester and then immediately after. And the reason for that is as the baby gets bigger, especially in the third trimester, it puts a lot of pressure on that pelvic floor muscles, which can cause those pelvic floor muscles to weaken. And also, as the delivery happens, especially for vaginal delivery, when the baby pushes through the vaginal canal, it can stretch those pelvic floor muscles as well as cause some damage to the nerves. A lot of the times there can be tear or lacerations, which again can cause trauma to those pelvic floor muscles, which can subsequently contribute to some of the pelvic floor dysfunctions. And then immediately postpartum, there are lots of hormonal changes that women go through, especially women who are breastfeeding. Our estrogen levels drop when we're breastfeeding, so that's known as hypoestrogenic state. So as a result, there are changes, anatomical changes as well as physiological changes that can happen to the vaginal wall, to the base of the bladder, urethra, which again can cause symptoms such as vaginal dryness, vaginal pain, urinary frequency, urinary urgency. The good thing is most of these symptoms do resolve by 6 weeks or so, but if they don't, then that's a time to consider talking to a specialist. The next question I get asked is, how can I prevent developing these pelvic floor dysfunction? The easy answer is to start with pelvic floor exercises. Now, when we talk about pelvic floor exercises, the first thing everyone thinks about is Kegels, which is right. The thing to know is pelvic floor exercises are safe to do before pregnancy, during pregnancy, as well as after pregnancy. Of course, during pregnancy and immediately after, you want to talk to your physician, make sure it's appropriate for you to do certain exercises, especially if you've had a complicated pregnancy or complicated childbirth. But again, with the right guidance, working with a pelvic floor physical therapy can be really helpful. The important thing about Kegel exercises to know is that it's not just about doing it, but doing it right, and also the money is in the repetition. Sometimes I think patients are easily frustrated because they've been doing Kegel exercises, but not really noticing any improvement. Remember, it's just like working out in the gym. It takes time, so don't give up. The other thing, or the other reason to consider doing the pelvic floor exercises with a physical therapist or a pelvic floor physical therapist, is that not only can they help guide you to do your pelvic floor exercises, but they can also help new moms learn about body postures, body mechanics, focusing on breathing techniques. Because remember, as a new mom, you're going to be doing a lot of various different kinds of activities. Carrying the baby, when you're breastfeeding, holding the baby in a certain way, picking the baby up from the floor, as well as those baby carriers, because those can be heavy. So if you're not really focusing on how to maintain the right postures, how to strengthen your core, how to work on your breathing techniques, these can have subsequent effects. So this is where working with a PT can be really helpful, because they can guide you and teach you the right way to do these exercises, as well as focus on your posture, your body mechanics, and breathing techniques. The next question: what is an episiotomy and what is a perineal laceration? So an episiotomy is an artificial cut that oftentimes your OBGYN or your midwife or your primary care doctor will have to make in the vaginal wall, and that's to enable the baby's head to come out. So what we do is essentially we make a cut from the vaginal wall and into the perineal muscles, and what that does, or what that cut does, it basically widens the vaginal opening and allows the baby's head and the body to pass easily. A perineal laceration is a similar idea, but it's not an artificial cut. It's basically your own tissue tearing as the baby is kind of passing through the vaginal canal. Now, what happens is, whether it's episiotomy or perineal lacerations, there can be trauma to those pelvic floor muscles and the nerves as a result of that. And also, as those areas heal, sometimes you can develop some scar tissue, which can cause pain with intercourse afterwards. And when we talk about lacerations, oftentimes you'll hear about first-degree laceration versus fourth-degree laceration. So first and second degree lacerations are very common, especially if you're having delivery for the first time. Those are just basically injury to the vaginal epithelium and the tissue underneath. They can be easily repaired, and once repaired well, they heal very, very well. The third degree and fourth degree laceration are the more complicated lacerations, which essentially involves your anal sphincter muscles. And for fourth degree, it's essentially a complete rip or a complete opening or a complete tear all the way from the vaginal opening all the way to your rectum. So these are more difficult to repair, and it needs to be repaired well, because if it's not repaired well, women can have long-lasting consequences after. For example, if you have a 4th-degree laceration that probably wasn't repaired well, or maybe it was repaired well, but essentially the tissue didn't heal appropriately, women can develop something called a rectovaginal fistula, which is essentially a false tract that can form between the rectum and the vagina. And what patients will complain about is that they're noticing stool coming out through the vaginal opening, which, as you can imagine, can be really traumatizing and debilitating for patients. Similarly, if the sphincter muscles or the anal sphincter muscles were not repaired correctly, whether it be for a 3rd-degree laceration or a 4th-degree laceration, women subsequently may notice that they're not able to control stool, something we call fecal incontinence. The next question is, what is a forceps or a vacuum, and why is it necessary? So both forceps or vacuum-assisted delivery is something we call an operative vaginal delivery. This is when, the baby is not coming out with the mother just pushing, or maybe the mother is exhausted and not be able to push the baby out anymore, and we need to get the baby out. So sometimes your OBGYN will use these devices to help guide the baby through the vaginal canal. A forceps essentially involves two metal sheets that we put across the baby's head, again, to guide the baby outside the vaginal canal, and a vacuum, which is essentially a suction pump that we attach to the baby's head. And again, the idea is it helps guide the baby out through the vaginal canal. And oftentimes we'll use it in case of an emergency where we have to get the baby out quickly, or maybe the mother is very exhausted and not being able to push the baby out adequately. The problem with some of these assisted deliveries is that, as you can imagine, it does cause trauma to the pelvic floor. So we do see that women who have had these operative vaginal deliveries will subsequently develop some sorts of pelvic floor dysfunction. Now, what are some normal changes that women can expect after vaginal delivery, and what are some abnormal changes? So normal changes can be things like a vaginal discharge, which is often bloody and mucousy. We call that lochia. Now that's normal for a few days to for some women can be weeks. Also, because with the laceration, oftentimes we'll repair them with stitches, women may notice that there's a lot of soreness and pain and discomfort with sitting down. A lot of these stitches that we use in repairing these lacerations nowadays are absorbable sutures, meaning they'll dissolve by themselves, so we don't have to remove them. But again, it can take weeks to dissolve. So for those many weeks, women can sometimes notice some brownish vaginal discharge, and oftentimes I'll have patients, they're concerned that their wound is infected. It's not. It's like I said, as those stitches dissolve, they give off a brownish discharge. But if you're ever worried, always a good idea to double check with your provider, make sure it's not infected. In addition to some of these anatomic changes, women can also notice things like constipation, hemorrhoids, urinary leakage, a lot of feelings of perineal laxity or vaginal widening. Most of these symptoms will resolve as the tissue heals and your hormonal status gets back to normal. But if it's still persistent and you're bothered by it, always a good idea to get a referral to see a specialist. The next question I get asked is, when can I have sex? So usually after a vaginal delivery, we recommend pelvic rest for about 6 weeks. And the reason for that 6 weeks is because the stitches that we use to repair the vaginal lacerations usually take about 6 weeks or so to dissolve. So up until then, we don't want anything in the vagina because you don't want that area to get infected. And also 6 weeks is about the right time by when the women may notice improvement in the swelling in that area. They're feeling more like themselves, they're stronger, they're not having a lot of discomfort. So after the 6 weeks, it is okay to engage in intimacy and have vaginal penetration. Realize that many times when you first start having intercourse after vaginal delivery, you may notice some pain, which we call dyspareunia. So that's pain with intercourse. There's a whole host of reasons for that. One of the reasons could be that maybe there's some scar tissue from the laceration or the episiotomy. Maybe the stitches haven't completely dissolved. Maybe there's still some remnants of it. Also, for women who are breastfeeding, because of the decrease in estrogen as a result of the breastfeeding, there's a lot of anatomic changes that we notice in the vaginal tissue. The vaginal tissue becomes very thin and can cause a lot of dryness, which again can contribute to some of the pain that women face with intercourse. A lot of the times I'll recommend using a silicone-based lubrication rather than the regular water-based lubrication, because the silicone-based can be really more comforting for those patients, as well as using a little bit of vaginal estrogen cream can help improve some of that dryness and the pain women have as a result of that. And finally, where can we find more resources? So the American Urogynecologic Association, which is also known as AUGS, created something called Voices for PFD. I'll put the link in the description below. It's a great resource. It's a website. It's free. You can check it out. It has a lot of good information about lots of different pelvic floor dysfunctions that we talked about, as well as some more specific information for new moms, which can be really, really helpful. Remember, every pregnancy is different. Just because you may have had a traumatic experience with your first pregnancy doesn't mean that's going to be the case for your second or third pregnancy, and vice versa. Just because your first pregnancy was perfect doesn't mean you cannot develop some of these pelvic floor issues in your second and subsequent pregnancies, especially if some of those pregnancies are later in your life. But the good thing is there are lots of amazing treatment options for any of the pelvic floor dysfunctions that women can develop. But the important thing to know is to be aware of them and know when to ask for help. I'm a big proponent of being knowledgeable about our own body, because only when we're knowledgeable and know about our own body can we feel confident and comfortable about what sort of questions to ask and get the appropriate help that we need. If you feel like you have questions and concerns and you're not being satisfied with answers that you're getting from your primary care doctor or your OBGYN, please don't be shy to ask for a referral to see a specialist, especially a urogynecologist. We'll be happy to see you and talk about some of the amazing treatment options that we have if it's appropriate for you. There's really no reason for you to suffer in silence. We're always here to help. Hope you found this video helpful, and if you did, like it, share it, and don't forget to subscribe to the channel. Till next time, bye!